Growing fears about Ebola here in America. Doctors and hospitals on high alert. One patient in New York in isolation and tested for the deadly virus as the plane carrying the second infected American aid worker completes its 5,000-mile trek set to land in Georgia this morning. ABC's Steve Osunsami is at Emory University Hospital with the latest. Good morning, Steve.
Good morning, George. We've been following this case for a couple days now, watching this very closely. We talked with the EMS unit that is going to be moving this patient from Dobbins Air Force Base to this hospital behind me. They also moved Dr. Brantley here on Saturday. They tell us they're taking extra precautions, wearing gloves and specialized gowns out of an abundance of caution. Doctors on high alert this morning at New York's Mount Sinai Hospital. A man with a fever and gastrointestinal symptoms walking into the emergency room Monday, frightening physicians.
We're going to work carefully with the CDC to make certain that this patient does not have the Ebola virus disease.
Just hours from now, aid worker Nancy Wright-Bull will land in Atlanta. Wright-Bull, the second U.S. patient infected with Ebola to arrive in the U.S., received an experimental drug in the days before her flight.
Nancy is able to walk around, and really the good news was that her appetite started to return.
The same experimental drug was also given to her colleague and fellow missionary, Dr. Kent Brantley. The sick physician rushed back to the state Saturday. Health officials aren't certain it's the drug that's helping, but friends from his aid group say the results are dramatic. The disease is often fatal, and there's some concern and fear in Atlanta.
If somebody, a nurse or a doctor, let's just say they get infected, you yourself and everybody agrees it's a 21-day incubation period. What if they go home and they take it to their family?
Paramedics moving Wright-Bull today are taking no chances. Exposed fabric, blankets, sheets will all be burned. We got to look inside the ambulance, the same one used to move Dr. Brantley. The bleach that I'm smelling is because we're dealing with Ebola.
Correct.
Many of these aid workers traveled overseas with their families who have since returned stateside. Their aid organization tells us that so far everyone appears to be healthy. George?
Thank goodness for that. Okay, Steve, thank you. Dr. Richard Besser here this morning as well. You know, everybody on edge given this virus, but this patient here in New York, almost certainly not Ebola.
Yeah, I mean, what we heard from Mount Sinai, very low chance that this is Ebola. This is around the 6th time someone's been tested in America like this. They traveled to the region, they had symptoms of fever that were consistent, and they were all negative. It's exactly what you want to do. You want hospitals to be on guard.
And now we know that both these aid workers were given this experimental drug, Z-MAP. Those at Samaritan's Purse seem to think this made the difference.
Right.
You're not so sure.
I'm not so sure. I mean, it's great that they're doing well, but this drug, it's a combination of 3 factors that target Ebola. It's never been tried in humans. In monkeys, it was given when they were infected, but they had no symptoms. They weren't sick. Here, they were very sick, and this kind of drug doesn't work that way.
It does appear, though, that both these patients are out of the woods?
Well, I mean, when you're hearing that they're up and walking about, the normal course for Ebola, if you're not going to make it, is it's a pretty rapid downward spiral. So the fact that she's asking for her favorite Liberian dish is terrific news.
That is good news. Okay, Rich Besser, thanks very much.